name is Daniel Kaysen, and I'm presenting on behalf of Group 6. We'll be discussing why we believe operational strategies are the key to successful outcomes in the healthcare industry. The members of our group are myself, Alan Clayton, Mary Frances Colley, Baxter Knight, and Molly Kate Poole. First up is our summary of this week's reading, Healthcare Needs Real Competition. The article posits that our healthcare industry remains chaotic, unreliable, inefficient, and crushingly expensive. The system has many suggested solutions, but the best idea of all is that healthcare needs more competition. Competition in the healthcare system can improve quality and efficiency, spur innovation, and drive down costs. Healthcare providers should stop arguing and try to fight the development of competition and make competing on value central strategy. Healthcare should be stressing the importance of putting patients first and creating a choice for them. So, as previously mentioned, they say that competition can improve quality, efficiency, innovation, and cost efficiency. And the 5 major catalysts that will accelerate the progress of this competition is by putting patients first, creating more choices, preventing rewarding purely based on volume, standardized value-based methods of payment, and transparent data. So before going into why we think operational strategies are the key to improving healthcare in the US, we feel we should first identify what's actually going wrong and what's going right in healthcare. So we found a study from Mirror Mirror in 2014, which found that the United States ranked last out of 11 Western industrialized countries in terms of healthcare that were studied in this report. There were several issues that the American healthcare system had, but the main ones that it found revolved around the efficiency of care, equity of care, access to care, and the amount paid per capita on healthcare in the United States. So in the US, the amount spent per capita was $8,503, and the country with the second highest amount was Norway, which only spent $5,669 per capita, which is a pretty huge difference. The data in this chart clearly shows some issues with the American system, and this was found in the report. This is just a summary of the data that they found. And although access and equity have been somewhat addressed through legislation in the United States, major problems still exist in terms of efficiency of care and cost of care. As you see, we rank 11th in both of those categories of the 11 countries that were studied. Additionally, the US doesn't rank very high in timeliness of care, despite the fact that the study also found that the United States has the highest proportion of specialists in the countries studied. So now the question becomes, how do we fix these 2 huge problems of poor efficiency and costs that are badly hurting our healthcare system here in the United States? We believe that the use of operational strategies in healthcare appears to be the optimal solution to these problems. Operational strategies are utilized in order to allow businesses to describe the processes that they perform and how each of those processes in turn contribute to achieving the business's objectives. In healthcare, the appropriate use of operational strategies will allow hospitals and other types of practices to clearly outline their procedures and systems utilized in the delivery of their services. These processes can then be evaluated for effectiveness and efficiency, which could lead to huge improvements in the 2 major areas of concern for healthcare as a whole, cost and efficiency. So we found that several hospitals and healthcare organizations have already started using operation strategies to improve quality of care, increase efficiency, and decrease costs. The first one that we found to study was the Thibodaux Regional Medical Center in Thibodaux, Louisiana. Here, hospital leadership employed prioritization methodology, including Pareto analysis, to identify areas with the biggest opportunity for improvement. Sepsis was targeted as one of the main areas for improvement based on the findings they had. So the strategy ended up setting a set of outcome goals, which included reducing overall sepsis mortality by 25%, reducing costs by 20%, and maintaining 99% patient satisfaction. The operational strategies employed to meet these goals included implement early recognition protocols in the ER, holding physicians accountable for following those new protocols, creating aim statements and process measures, initiating 3 and 6 hour sepsis bundle protocols, and developing an algorithm to identify at-risk patients earlier. The results of the operational strategy were impressive. Mortality rates were cut to half the national average, costs were reduced by 7.3%, and patient satisfaction was increased to 93%, an increase of 7%. Our next example is Nationwide Children's Hospital in Columbus, Ohio, which has a business process improvement department that facilitates the IMPACT program there, in which employees can submit ideas for process improvement to achieve better outcomes. Input from this group led the hospital to seek zero harm status. The outcome goals were to reduce the number of hospital-related harm incidents to 0, which is quite a lofty goal. Several operational strategies were implemented in order to meet the goal. The first was implementation of a tracking system to measure and analyze patient care complications, seeking to increase patient safety. Also, error prevention training for all 8,000 employees of the hospital. Multidisciplinary microsystem teams to focus on tactical issues. Clinician and administrator training in the improvement methodology, and leadership methods to reinforce prevention techniques. They also experienced great outcomes from their operational strategy. Over the course of 3 years, Nationwide reduced the serious safety events rate by 83%, decreased preventable harm events by 55%, decreased risk-adjusted all-cause hospital mortality by 40%, and decreased harm-related costs by $1.8 million. These results were so good, they actually ended up winning an award from the Children's Hospital Association through Race for Results program, which honors hospitals that demonstrate significant clinical or business improvements using data. So the conclusions of our findings are that research has shown that the United States lags behind many developed countries in terms of healthcare. In particular, our healthcare system here struggles with high costs and a lack of efficiency, both of which lead to a decrease in quality of care. Utilization of operational strategies within the healthcare system leads to dramatic increases in efficiency and quality of care, as well as decreases in cost, as evidenced by Thibodaux Regional Medical Center and Nationwide Children's Hospital. Therefore, the use of operational strategies in healthcare is the key to improvement in care.